And good evening. Welcome to On the Go with Dr. O. I am your host, Dr. Onyeani. I'm here tonight with our guest, Dr. Ngozi Wosu, who's a clinical pediatrician in Newark, New Jersey. Tonight, we're going to be discussing the COVID-19 vaccine and whether or not children should be required to take the vaccine prior to going back to school. Dr. Wosu will give us a little bit of a intro as far as who she is, and then give us a little bit of her experience as to what she's seen since COVID-19 began.
Well, I'm a general pediatrician. I was trained right here in downtown Newark, UND&J, and I've practiced in a very large private practice since 2005. And I've been a hospitalist for several years, emergency room, neonatology, so pretty much the works. So right now, I'm in a general practice in North Jersey, and I do a lot of a lot of locum tenens work for doctors who would like to take a break or they need help managing their very busy practices this time.
Wonderful, wonderful. Well, thank you for that very impressive resume. And again, we are very happy to have you on the show this evening. So, without further ado, I'd like to start off by, just asking you, what has been your experience since the beginning of the pandemic? Have you seen a lot of children afflicted by the virus? Have you seen a lot of children succumbing to the virus? What has been your experience thus far treating children?
I've actually had a lot of patients who have been affected by the virus. Early on, I actually diagnosed one before we actually had the information that we all need to be wearing masks all the time. It was very early during the flu pandemic, which is like a yearly pandemic that we have. But the symptoms are so similar to the flu that I ended up diagnosing a COVID patient by just looking for various viruses besides the flu. So I've had a lot of families where the entire family is afflicted, and often older members of the family will pass away. Um, I've had children that I've had to send to the hospital. I'm very lucky that no children have succumbed, but a lot of the families have been devastated in some way or another. And then there's some families where everybody had URI symptoms or loss of taste and smell. And besides that, nothing much. But in general, we see a lot of fever, um, body aches, stomach complaints. COVID has a lot of various symptoms and it can mimic any number of things.
Absolutely, absolutely. So, Dr. Wosu, one of the features that I noticed when I was reading your resume and reached out to you was the fact that, you seem to be a doctor who doesn't necessarily run for medicine right away. You like to take more of a holistic approach in certain aspects of your care. And so I'm curious to know, for the patients that you did see that did test positive, what did you prescribe, or what kind of advice were you giving the families as far as treatment for the virus?
Well, first things first, I usually tell families that we need to remain calm. Let's not worry in advance before anything has happened. You get a positive result and you have no symptoms yet, I would just try to remain calm. But some of the basic things that we do to just maintain general health and boost our immune system are just making sure that the child gets a good amount of sleep, eating healthy food, try to limit sugar from the diet as much as you can. I mean, added or artificial sugars. We had a little bit of a situation because with the quarantining, people went and shopped and had a lot of extra food items, including snacks. And because schools were closed, a lot of families were working from home. There might have been some boredom and some extra snacking, and then inactivity. So I've seen a lot of children gaining an excessive amount of weight this year. Some children have gained from anywhere from 15 to even 45, 50 pounds in several occasions if you are somebody with a slow metabolism and you're not very active. So just obesity alone in children and inactivity can decrease our immune response, make us more susceptible to viruses. Also, frequent hand washing, um, mask wearing, but correct mask wearing, not the mask wearing where your nose is hanging out, or you're frequently removing it in public locations. Also, vitamins, making sure their vitamin levels are up to date. So if they have um, a vitamin D deficiency, or even if they don't, most of us, but prior to the pandemic, whenever I've checked vitamin D, almost all the time it's very low because we're mostly covered. Those of us who have a little extra melanin have sunscreen, so we're not absorbing all of the vitamin D that the sun is providing. There's also um, vitamin E, there's zinc, there's a lot of other holistic um, substances that we've taken for other reasons, like echinacea, uh, golden seal, one very popular one right now. Uh, there's several that are on the market right now, but we've been taking them for just colds and flus in the past. But I say, if it's not going to harm you, I mean, go for it. I think
Absolutely.
making sure they have multivitamins.
Mhm. So, based on your extensive experience, I mean, you've been practicing for almost 2 decades now, and you've seen a lot come through the offices that you've been in. One of the questions that a lot of the parents have is, should I vaccinate my child, particularly the children who might be going off to college? And I think there's a lot of uncertainty. There's a lot of confusion because, to your point, I think what you described as far as children who are in fact positive, but not necessarily succumbing to it. You said you hadn't seen anybody. I'm sure that there are those who have, and obviously, even one life loss is one too many. But I think there are a lot of parents who are a little concerned about the prospect of schools requiring um, vaccinations for children prior to the child going back, whether it's school, grade K through 12 or college campus. What is your opinion on that?
Well, actually, that prospect is kind of a ways off for now. Um, Most parents, they're asking me what I feel about the vaccine in general, as far as
Mm,
like them getting it, if they
okay.
eventually get to the point where it's their turn in the queue. So most parents um, are referencing some of the issues that we've had in the United States regarding medical mistreatment of people of color or other
Mm,
marginalized groups. So we have to address those issues. And of course, there hasn't been any kind of significant truth and reconciliation movement in this country to deal with what actually happened. But um, it's really interesting and important that we're starting to have this conversation now because vaccine hesitancy is is being discussed openly in the media. So we have to get into communities of color and explain why this vaccine is safe and effective for them. However, as far as getting children vaccinated, they are going to be likely the very end of the line of people who will get vaccinated, because they're the least likely to succumb, even though there are quite a few children who have passed, but there is no difference. I mean, a significant difference between the way children are responding to this vaccine, this virus, versus the way
Mhm.
adults are responding. So the best we can do right now is try to separate children and isolate them, and then vaccinate the people who are higher risk, elderly people and healthcare workers and people with
Interesting.
comorbidities.
All right. And, you mentioned a couple of things that I definitely want to expound upon in our next segment. You mentioned people of color and how they've been disparaged when it comes to healthcare, among other things in this country. I definitely want to discuss that in more detail. And I also want to touch on what you mentioned just now as far as children being last in line for the vaccine. So what we're going to do, though, we're going to take a little bit of a break right now. I'm going to just kind of get ourselves prepared for segment number 2. I hope you guys are enjoying this conversation so far, and we'll be right back with On the Go with Dr. O.
It's an onion.
Welcome back to On the Go with Dr. O. I'm your host, Dr. Onyeani, and our guest tonight is Dr. Ngozi Wosu, who's a pediatrician in Newark, New Jersey, and we are discussing the COVID vaccine and whether or not children of college age should be required to take a vaccine prior to going back onto campus. Also, too, should children, school-age children, grades K through 12, should they be required to take the vaccine? And at the end of our last segment, Dr. Wosu touched on a couple of topics that I'd like to go back to. The first topic that she discussed was how the Black and Brown community has been disparaged for years when it comes to many aspects with regards to healthcare, with regards to housing, financials, but obviously this evening our focus is on healthcare. And I had a question to follow up on what you began to speak on, Doctor. One of the things that I've looked at and some of the projects I've worked on has dealt with the overall environmental status that many Black and Brown people find them in, and how that can also affect their health. And I guess one of the questions that I have is, we've been hearing on the news how it appears as if those who are Black and Brown are seemingly either more susceptible or just seem to be those who have a higher I wouldn't say propensity, but they seem to have underlying conditions that seem to make them more likely to be not only a statistic as far as those who test positive, but in a lot of cases succumb to the virus. And I guess the question that I have is, could it be argued that perhaps it's not so much that they don't have as good an immune system due to genetics, but more so due to their environmental factors that they've lived in for so many years, where, when you look at redlining and you look at other unfortunate practices that have been put into place where it causes Black and brown communities to be set up in locations that aren't the most favorable when it comes to our health. Could it be that COVID-19 has now exposed some of these pitfalls that Black and brown people have had to deal with for many years?
I definitely agree. I think there's many factors that are contributing to a lot of people of color, especially Black and brown people, being exposed to and succumbing to the virus more than some other groups. Well, one of them, well, some of the things you just mentioned, uh, the the effects of systemic racism, as we discussed, the um, possibly having to live in some conditions that might be crowded, um, or having forward people facing jobs, community facing jobs, such as uh,
Like a bus
such
driver,
like bus drivers and uh, sh- grocery store, and even people like you and I. I mean, we're still people of color, but we weren't necessarily able to take a break and work from home. We have jobs where we work with our hands a lot. Anybody who works with their hands a lot. So not just Black people, but one other community that has been experiencing a lot of infection rates is the immigrant community, or especially the recent immigrant community. So a lot of the institutions that we rely on, especially those of us who have the privilege of staying home, we rely on those delivery people, those restaurant workers, those hospital workers, people who make the American engine run. And very often they have less protection. Maybe they have lower pay. Well, for sure, lower pay. So they don't have any kind of financial cushion to stay home. And even people, they seem to be getting punished in a way. If they get the virus and they test positive, God forbid, if they don't even have symptoms, they have to quarantine. Now they're losing money. There's a lot of, you know, for people who own homes, the foreclosures, people having difficulty making their rent, and people sometimes they don't have the ability to stay home. And we're also exploring more the effects of systemic racism, just as far as um, experiencing violence or threats of violence, or even just the stress of experiencing microaggressions and macroaggressions in your life. And stress alone weakens your immune system. And
Absolutely. Absolutely. And so, to that point, Doc, I guess one of the concerns that could be raised is if we can agree that uh, people of color are more susceptible to the virus based on environmental issues, one could argue that instead of trying to push a vaccine on them, perhaps we should look at changing laws so that they're not subjected to the very stressors that we just mentioned. Perhaps instead of trying to push the vaccine, maybe we should look at, maybe doing more to improve the type of nutrition that is available. When we look at a lot of Black and brown communities, we're looking at liquor stores, we're looking at fast food places. These are things that are very quick to diminishing our immune system, and it could, potentially, as you suggested, leave us more susceptible to the virus and the effects of the virus.
yes, and a lot of people of color are experiencing environmental racism as well, where they have toxic waste dumps, they have increased traffic, they have various other things that lead to asthma, hypertension, diabetes, food deserts. But the thing is, we've been aware of these disparities for quite a while, and there hasn't been the political will to do anything about it. Right now, they're just starting to, well, not just starting, there are some people in politics that are working uh, to change these conditions and some people who are working to maintain these conditions. Right now, there's been some executive orders, but it's only been about a week. So we'll see what happens. But it's going to be a lot faster in a case of an extreme emergency, as is COVID, where we're heading swiftly towards 500,000 deaths in 1 year. Majority people Black and brown, and we don't. The amount of energy and time it's going to take to close all the liquor stores and make sure the schools are up to date and up to code and get all the lead out of the water. I mean, how many people will be dead by then? I think we can do both, and we have to do both. That we
Well, I
can't go
guess
on like this,
well, I guess
you
the
know.
concern is if the argument is that, you know, the people who are more susceptible are only susceptible because of these factors. I guess the concern that I have is where it appears as if, you know, they're trying to push a needle as opposed to trying to push legislation. I think that, you know, one could bring up the argument that, you know, you said we can do both, but it doesn't feel like both is being done. It feels like only one part of that is being done. And in
It's
a way
just
that I've never seen any sort of legislation being pushed for better schools. I've never seen any legislation being pushed for better housing to the extent in which we would not see these stressors being having such an effect as it does now on the community. I guess the concern and, you know, what I've heard from several people that I've spoken to is, you know, they're quick to push the vaccine, which hasn't really, you know, been tested enough. But they're not as quick to want to rectify the wrongs that have been, you know, in the communities for decades now. And I guess that's part of why there's so much skepticism amongst those in the Black and brown community.
I think we just have to pay better attention, just as a population. That there are people who are putting forth legislation that up until this week wasn't even being voted on in the Senate. There's been about 500 bills that have been passed that address this very issue in the passed by the House and have not, they've just gone to die on Mitch McConnell's desk. So he is no longer the majority leader. So it's only been a week. So let's see what happens. We've already passed a few, or not passed, there have been several executive orders towards this end, including a very major collection of environmental orders just yesterday. So, you know, it's been a week. And based on that, a lot of things do need to be codified in law with the House will likely pass it, but some of these are very large measures that are going to require, in some cases, the 60 vote margin, unless the filibuster, which is a remnant of Jim Crow, so
Okay.
is eliminated. So we'll see. But the things that we can do right now to stop the dying, because at this moment, hospitals, a lot of hospitals are on divert. So what I mean by divert is they have no more room for any kind of
Mm.
sick people. So they're becoming just big COVID treating facilities. So if you have a heart attack, good luck to you. If you have appendicitis, if you have any of the regular things that used to bring you to the hospital, asthma attack, good luck. There's some
Have
hospitals
you
in Texas.
have you experienced that? Have you experienced that up here, Doc, with the hospitals being overloaded?
Yes, yes. And, you know,
Mm.
I've experienced it on a very personal level because my own parent had a non COVID related medical emergency that required some ICU care several times in a row over the past 5 months. And I've just been
Absolutely.
crossing my fingers and praying. You know, at the time while she was in the ICU, there were COVID patients in the ICU. So, and there
Absolutely.
were times when I could visit and times when I couldn't. So, but there's
Doc,
hospitals where
I'm sorry,
there,
not to cut you off, but we're running out of time, and I wanted to get to one more topic about
sure, sure.
the children that you mentioned. You mentioned that, you know, the children would be last in line to receive the vaccine. So 2 points. Number one, you did mention earlier in the first segment that as far as you were aware, not many children had succumbed to the virus. So based on that, and obviously a lot of parents have seen that as well, I know there are a lot who don't want to have their children vaccinated. What do you say to those parents?
So when you say succumbed, we're talking about death, right?
Correct.
Because
Correct. And
many
we only have
children,
a minute left, Doc.
yes,
Just so you're aware.
many children are positive and they're very capable of transmitting the virus to their teachers, their families, and then they're the ones that end up dying. Even though there are children who have died, including infants. So,
Mhm.
the flu vaccine has been mandated in schools in some cases. And the flu, a lot of people were getting it and they were showing signs, and some of them were dying, but not to the extent of the entire population being affected the way they have with COVID
And
19.
obviously, we can also discuss the flu vaccine as well. But, with the last 15 seconds that we have, I do feel that, we should definitely do a little bit more research. To your point, we do want to protect the teachers and the parents, but they are getting vaccinated. So I think that it would be, responsible of us to at least see what the research looks like before we start talking about vaccinating children. But unfortunately, we have run out of time. This is a great, great discussion. Dr. Wosu, I want to thank you so much. You were absolutely phenomenal, very informative, and we do appreciate you being on the show tonight. This has been On the Go with Dr. O. We invite you to watch our next episode, and we thank you for watching this episode. You all take care of yourselves. God bless, and good night.